I'll ask you now to come forward and take your seats as we move on into this afternoon's session. Okay, here we go. So this is now moving forward into the frontline battle strategies, and we're going to be kicking off with Anna Theophilos, speaking to us on vaccination through pharmacy, strategies and measures of success. Thanks very much, Anna, for coming up. Here you go.
Thank you. It'll teach me for talking all lunch and then getting a minute warning, so I just had a quick drink. Thank you for having me today. It's been a whole year since I was announced as the PSA National Vaccination Ambassador, and it's my second time speaking here. So the first time was quite a privilege, but very overwhelming. Today I am all excited to speak to you today because we've had a lot of lessons in pharmacy over the last 12 months, and I'm really excited to share through the lens of the strategies and measures of success. And when I was thinking about how to approach today, Andrew was very generous and said I could approach it how I saw fit. I was thinking about this quote from Henry Ford, and it kept playing over and over in my mind. Coming together is a beginning, keeping together is progress, working together is success. And as I was thinking about success and how to measure it, I kept returning to this quote because if we look at the evolution of pharmacy vaccination, we've already achieved the beginning. We're still here, 12 years later, and of course we've made significant progress. But the next chapter, truly working together, that's true success. And I'd like to suggest that pharmacy vaccination has reached a point of maturity where success is no longer about proving or showing that we can vaccinate. Success is now about alignment, both within our profession and across the broader healthcare system. Alignment of policy, alignment of funding, alignment of systems, alignment of professions, and ultimately alignment of the patient experience. But before we talk, it wouldn't be a good presentation if I didn't give you the landscape of pharmacy in 2026. We have over 6,000 community pharmacies across Australia. We are one of the largest healthcare networks across this country. 97% and 74% of Australians live within 2.5 kilometres of a community pharmacy. On average, patients visit pharmacies 18 times each year, resulting in more than 440 million patient interactions annually. It's probably no surprise to find out then that 84% of Australians trust pharmacists' advice. In 2026, we can initiate and administer 25 vaccines, and we have proven delivery. In the last financial year, we delivered more than 4.5 million vaccines. So regardless of where you sit on the role of vaccination or pharmacist-led vaccination, one thing is undeniable. Pharmacy has become a critical part of Australia's vaccination infrastructure. The true measure of success is no longer whether pharmacy can vaccinate, it's whether we can achieve full alignment between this extraordinary infrastructure and our public health goals. So why the word alignment? Because beyond being a nice buzzword, and for those who know me, you know I like a nice buzzword, I think alignment is something we can actually define. And it comes down to 9 elements that need to work together, and conveniently, they also spell out the word alignment. You're welcome. Access, legislation, integration, governance, nationwide consistency, multidisciplinary care, education, navigation, and technology. And while we've made enormous progress, the reality is that not all 9 elements are aligned. So let's explore where we've succeeded, where gaps remain, and what success looks like from here. So number 1, access. One of pharmacy's greatest strengths has always been physical access. We are embedded in the communities. In fact, there are more community pharmacies in Australia than Woolworths and McDonald's combined. But I can already hear you say, if pharmacy is so accessible, why aren't vaccination rates dramatically increasing? And to answer that, I'd like to invite you into the world of pharmacy for a moment. Because access is not simply about opening the door to another provider. As Paul mentioned this morning, pharmacy is doing 30% of the flu vaccines, yet vaccination rates are not going up. It's just people changing provider. True access, therefore, is about removing every barrier there is between a patient and that particular provider. And while pharmacy has solved the geographical problem, there is still a number of unseen complexities preventing pharmacy access reaching its full potential. So to understand this complexity, let me take you on the journey of how we have, progressed, or the timeline of pharmacy vaccinations. So pharmacist vaccinations began, 2014 was when Queensland's influenza pilot began. So one vaccine, one state. Then came expansion, more vaccines, more jurisdictions, more opportunities. COVID, of course, accelerated that journey dramatically. The profession mobilised, and pharmacists delivered more than 10 million COVID vaccines across Australia. And then in 2024, the introduction of NIPVIP formally recognised pharmacy as a funded vaccination provider, removing one of the most significant barriers to access, cost. And it was Michael giving us great news this morning that that's going to be expanded even further in next year's, or from the 1st of January. The recent federal government expansion of NIPVIP funding to include children under 5 is an important step forward, because for years pharmacists found themselves having difficult conversation with patients. The vaccine was free, but the administration wasn't free. And for many patients, that fee became the difference between vaccinating today and delaying vaccination altogether. But funding alone isn't enough. Think about it. We've built a national capable workforce. We have national funding, yet we continue to operate with state-based legislation. So to put that into context, if you were to see a GP in Victoria for a basic ear infection, and that would be fine. You'd go in, you get your antibiotics, they'd have a look in, and you were to drive across the border to South Australia and book in to see a GP, but they said, oh, sorry, we don't check ears here. That would be the most absurd thing you had ever heard. The confusion would be enormous. Patients would lose confidence in where they could access care. Healthcare professionals would struggle to provide consistent advice, and the system would become fragmented and difficult to navigate. Yet this is exactly what happens with pharmacy vaccination. We have a national immunisation program, we have national public health goals, we have national clinical recommendations, we have the Australian Immunisation Handbook, yet vaccination in a pharmacist's world still varies depending on the state in which they practice, and a patient's access to that care depends entirely on what side of the border they happen to live in. So if we want national consistency, if we want consistent vaccination outcomes, we need nationally consistent access, which brings me to legislation. So this chart will be no stranger to many of you, but it remains one of the most practical visual representations of what pharmacy vaccination access looks like across Australia. Different vaccines, different ages, different permissions, different rules, and ultimately a different patient experience depending on where you live. Patients have openly told me that their younger children don't receive an influenza vaccination because they simply never got around to making a separate appointment with their GP. And in Victoria, I can't do anything about it. I can vaccinate their 6-year-old, their 8-year-old, their 10-year-old. I can vaccinate their entire family, but I can't vaccinate their 4-year-old, often the child at greatest risk. And the result isn't just reduced access, it's confusion. Families don't understand why one child can be vaccinated and another can't. They don't understand why the rules change depending on age, vaccine, or where they live. It leads to confusion as to why does the state government trust you with one child, but they don't trust you with the other? And I guarantee you, when healthcare becomes confusing, it starts to feel difficult. And when it feels difficult, people delay. And when people delay, opportunities for vaccinations are lost or they are simply forgotten. As national funding expands to include all ages, alignment with the Australian Immunisation Handbook across all jurisdiction is overdue. State legislation must align with federal funding, and it's pretty much as simple as that. So when I'm standing here, so the idea on this chart is that the ticks mean that state or that vaccine can be delivered according to the Australian Immunisation Handbook. So we want to be able to see ticks universally across this chart. If we can align these hidden complexities, so the state-by-state kind of legislation and access to funding, then I can guarantee you that that's what true access looks like in pharmacy. And you heard it here first, that vaccination rates will definitely increase. But alignment, of course, does not stop at policy. It also needs to happen within practice, because even with the right legislation, funding and access, vaccination rates won't improve if vaccination remains a separate service sitting on the edge of healthcare. It must become integrated into care itself. Oh, there's a little photo. I had to submit my slides early. That was me in Parliament advocating with this chart in my hand. So that brings me to the next point, integration. One of the questions I get asked regularly is how I grew my one pharmacist, one clinic room vaccination program from around 200 vaccines to over 6,000 to 7,000 this year. And the answer isn't that I became a better vaccinator, although I'm pretty sure the practice probably helped. The answer is integration. So vaccination stopped being a service that we offered, and it became part of the care we delivered, and it became a standard expectation of care. So just like I am outraged, I genuinely am outraged when I go to my GP and they don't take my blood pressure, because that seems to be just what happens. So should our patients be outraged when their vaccination records aren't checked also. For me, patient interaction became an opportunity to identify risk, assess eligibility and make a recommendation, because patients are not thinking of their healthcare in silos. They don't separate blood pressure checks, medicines, chronic disease management and vaccinations into different categories. They simply expect healthcare professionals to help them stay well. And if vaccination sits outside of routine care, it's always going to be viewed as optional. But when vaccination becomes integrated into care, uptake stops relying on patient demand and starts being driven by clinical recommendation. So how is it done? I've presented this a couple of times. I always find it helpful, especially for new pharmacists that are following along, but I do believe it can be used in any setting. For us, vaccination is a team sport. So in terms of identifying and directing the patient, the who is any team member. So if you came into our pharmacy, you would like to think that you're the one seeing everybody and having all of those conversations, but I guarantee you that Margaret on reception knows more about what's happening in your patients' lives than you do, in the same way that my pharmacy assistants hear things that create vaccination opportunities. So when a patient asks my pharmacy assistants for gastro stop, because they're heading overseas next month, before I even know it, they've been walked down to the clinic room because my staff know that they'll need a typhoid and a Hep A injection. Of course, that's only the beginning of the vaccination interaction. The team is also involved in the appointment booking. The admin work is complete and the pre-screening is sent to them. And my team will sit down with them. I'll be in that care clinic room seeing somebody else, and my team's out because their pre-screening will have come through on their phone. They're helping to complete those types of administrative burden, because the goal is simple. When the pharmacist walks in, our focus should be only on the clinical care, not the paperwork. And this is, obviously step 3, the review and vaccinate, where I'm answering questions, I'm assessing risk, making recommendations and vaccinating. So alignment of vaccination within your workflow rather than alongside it as a separate service is one of the most important things that drives vaccination access. So the next part of the alignment what is this, an acronym, is governance. And it rarely gets people excited, but it is actually something that pharmacy does very well. So if I'm honest, obviously I'm biased because it's the PSA, but we have some excellent practice guidelines for pharmacists providing services. We have our own accreditation requirements, we have cold chain standards, we have local procedures. But all that to say, it's something I don't really want to spend a lot of time on this morning, but it is really important to have strong governance so that we can grow safely and the quality of our vaccinating services remain at the highest level. One of the defining features of a mature profession is consistency. When a patient walks into a pharmacy anywhere in Australia, they should know what to expect, not just in the medicines we supply, but in the services we provide. And I probably, if I had, and I'm being very open and very raw with you this morning, this is probably my pet peeve, is that we don't have a nationwide consistent experience with pharmacy. And I had this aha moment a few months ago when I was vaccinating in Tasmania, and I ran out of the most critical part of any vaccination clinic, Chupa Chups. The solution for me was easy. I ran into my local Coles. I ran into the aisle, whatever the confectionery aisle is. In fact, I ran 3/4 of the way down, looked down to the bottom, and Chupa Chups was sitting right there. Now, I walked into that Coles confident that I was going to find Chupa Chups. I knew exactly what the store would offer. I knew exactly what aisle to walk down. And that's where pharmacy still has work to do. Because too often, patients walk into a pharmacy asking for a vaccination and hear, "Oh, we don't vaccinate," or "Our vaccinating pharmacist isn't on today." Imagine walking into a pharmacy with a prescription and being told, "Oh, sorry, we don't dispense today." Yet we as a profession have continued to accept this variability when it comes to vaccination. It would never occur to me to book a GP appointment and wonder whether I could get my blood pressure checked or whether I could be vaccinated. And I guess for the pharmacists in this room or online, that's the goal. That's the baseline. Pharmacy vaccination has matured beyond being an optional service. Alignment of that service, it must be the standard of our care. Success through this lens is achieved when a patient can walk into any pharmacy in Australia and confidently expect a vaccination to be part of the services offered there. Not because they checked first, but because that's simply what pharmacies do. But here's the thing. Pressing the wrong one, apologies. Even if pharmacy in Australia vaccinated tomorrow, we still wouldn't solve the problem. Which brings me to perhaps one of the most important questions for today's audience, and perhaps one of the most debated of all time. Who owns vaccination? And perhaps more importantly, why are we still asking? Because after 12 years of arguing about it, we still have people who are not vaccinated. Is it general practice? Is it pharmacy? Is it nursing? Is it public health? Or is it none of the above and just dealer's choice? My answer, of course, is none of the above, because public health challenges don't belong to one profession and neither do the solutions. If one profession could solve under vaccination alone, it would have already been solved. Success isn't achieved when one profession vaccinates more. Success is achieved when more Australians are vaccinated. When recommendations are consistent and when opportunities are recognised and when patients hear the same message regardless of which healthcare professional is sitting in front of them. And it's why now when I'm providing or building vaccination solutions that my goal is to provide provider agnostic solutions. So I might prototype them through pharmacy because that's the world I know, but the goal is never pharmacy. The goal is vaccination. The goal is creating systems that connect eligible patients to vaccinating providers, regardless of whether that provider is a pharmacist, a nurse, a GP, could be an Aboriginal health service provider, a local council. because people don't care about professional boundaries. They care about whether someone helped them navigate the system and get protected. And if we're serious about vaccination rates, perhaps this is the thing that we should all align around first, because evidence suggests that we actually all have work to do. Most under-vaccinated adults saw a healthcare provider in the last 12 months and were not recommended a vaccination. And despite a recommendation from a healthcare professional being one of the most strongest predictor of vaccine uptake, the challenge, therefore, is not contact with the health system. The challenge is ensuring that every healthcare interactions becomes an opportunity to discuss vaccination, and that's why multidisciplinary care matters so much. We know that involving pharmacists in vaccination programs increase uptake by about 51%. And it's not because pharmacists are somehow better at vaccination conversations than anyone else, but because when patients are presented with more opportunities from trusted healthcare professionals in more settings, vaccination rates go up. When professions align around a common goal, vaccination rates increase. So as I mentioned from the outset, the challenge is no longer teaching pharmacists how to vaccinate. We know how to vaccinate, but do we know how to confidently recommend? Do we approach vaccine conversations with the same confidence, direction, and clinical authority as every other intervention recommends? And I know pharmacists, mate, if they've got something to tell you, they'll want to tell it to you. If they want to ring you and tell you about a drug interaction, they're going to tell you. So we need them to have that same focus and energy when it comes to vaccinations. For me, the challenge of this last year and the real focus is making sure that we're going beyond eligibility. So looking at the real facts that change the conversation. And we all are really, quite blessed to come to these conferences, CDIC, 3 days of hearing the latest, what's happening with RSV and all of these things. But the reality is life is busy, right? They're dispensing, they're trying to do things. So providing this real-world evidence in a tangible manner allows them to then communicate that with the patients, so that when a GP mentions RSV vaccination, because the next person they see is usually us, and they say, oh, what do you think? We can actually say, yeah, we know that 1 in 3 actually have, a functional decline at the 2-month post-discharge after hospitalisation. Or when they say, oh, I've had 8 COVID shots, surely I don't need anything more, we can talk about that immunosenescence really confidently, and we know why that they need that recommendation. We can talk confidently about conjugate vaccines, and when even at flu season, how many people are saying, hey, it's a H3N2 season, and what does that mean for the older adult? So we really need to make sure that not only are we just identifying, but we can actually have these clear conversations to make sure that they're hearing it from every corner of the healthcare system. Okay. So let's assume that we're aligned on everything that I've spoken about so far. So policies, tick. Funding, tick. Legislation, tick. Integration, tick. What becomes possible next? One of pharmacy's greatest strength has always been for its ability to connect people. It's something I'm proud of, and it's something that I believe that we do very well. So connecting patients to providers isn't new. We've been doing it for years through our corporate flu clinics and our workforce health initiative. So it won't be a surprise that when a public health challenge of needing to increase MMR vaccines rapidly in Victoria for people not covered by NIP aged 20 to 59, for me it became an opportunity to test whether alignment could actually be achieved. So first from across, as I said, I often will use pharmacy as the prototype because it's the industry I know, but then potentially across the broader vaccination workforce. So essentially, I presented it at CDIC on Monday, so I'm sure many of you had been around, so I don't want to rehash what I've already done. But essentially, the challenge was this. How do you take a public health priority, identify the patient, remove the financial barrier, and connect them to the vaccination provider? Probably the easiest way, although I don't have a mic, so I'm going to watch it down here and kind of talk you through. We essentially created a hub where I reached out to over 500 pharmacies across Victoria, and we connected them into a console we connected with 6 out of the 9 local public health units, so essentially enabled a voucher model because it was outside of traditional funding. So they kind of, we got voucher codes from all of the different banner groups, all the independent pharmacies could participate, so any pharmacy that wanted to. And essentially we created resources that went out to notify patients that they were eligible, and obviously the public health units did this as well. And this was the result. So there was this, the QR code would take them to this link, and then they would come along and they would enter their postcode. So the first postcode that I've entered in here, you'll see in a moment, will be Melbourne, just because that's obvious. So wait for that to catch up. So on this page, we had sort of what the program was, what information about measles. Once you pressed the postcode, it brought up, it geolocated all of the pharmacies that were closest to you within sort of by distant. Obviously, as I said to you before, we had multiple public health units involved. So if I type in a public health unit that wasn't involved, we didn't want that to be a door in the face. So we had visit their website so that you could find out sort of how they were running the program. Now it's going too fast for me. So now we go back and we type in a postcode, and then instead of it being this fragmented system, you would then click on the pharmacy that you wanted, type in your details. The public health unit wanted obviously reporting data, so we had minimum data entry fields, so they wanted age, sex, Aboriginal Torres Strait Island status, so claiming the voucher came straight here. It went to their email address, but then also we had individually put every booking link to each pharmacy, so then in the same kind of workflow, you would then go and book in and use the voucher code for it to be no charge. I'll wait till that has its little finish point. But yeah, this was, I think, a great success in the fact that we're only 10 weeks in. We've issued over 3,000 vouchers. And that's, how to explain it? That's with just, pure let's pivot as it goes. This was not some, we're going to really plan it out. If you know me, my vibes are I'm just going to get in there and get it done. So now we're about to go into the next 10 weeks where this platform is ready to go, and we suspect that we'll get to 10,000 MMR interactions, and that's purely linking public health initiatives with the vaccinating providers. The thing with this is, when we set it up, it wasn't supposed to be just for pharmacy, and it doesn't necessarily have to be provider specific. There's no reason that every single booking platform couldn't be integrated into one solution. And I think that that's where I'm learning, and it's been a really big growth for me in the last 12 months, is that often we work in our individual silos and we're all trying to solve the same kind of issues, but really the patient doesn't really care. They just want something that's easy. They want to be able to type in their postcode and they want to know where to get vaccinated. I'm looking because I don't know it's time to go. Okay. The final piece I have is technology. Hopefully maybe what I just showed you is sort of how we scale things. I was really impressed with some of the initiatives that have been done, but I'm not going to stay here because it's stuff that we've covered. But I do want to finish on this quote, and I think if you take anything from today, please, put it on your screenshot for a day. Coming together is a beginning. Keeping together is progress. Working together is success. Thank you very much.
Thanks very much for bringing us back with so much energy after our lunch. It now gives me great pleasure to be able to welcome up to Dr. Leanne Jones, who is a general practitioner at the Windmill